Everybody. Hopefully you can all hear me now at this point. To kick us off, as Karen and Maureen said, I would like to ask you to engage in our chat and a little bit of discussion, if you wouldn't mind. You may find that after a while, listening to somebody else gets a little boring, so I'd love to be able to have you participate with me here. So the first thing I'd like you to do, if you could find the chat button there, which is the little bubble down in the bottom of your icons there, I'd like you to chat in and let me know what has been something that you've learned during the pandemic when it comes to taking care of patients. What's something you've learned? I'll just give you a second to fill that in. Listening is important, absolutely. So important. Yeah. Peel the onion, push back the outer, yep, to be a better listener. Yep, going back old school, right? Getting together with people telephonically. Sure, I agree with that. Yeah, be a better listener. Let's see. Great. Creative, right? It's tough to engage clients, have to be creative in finding ways to reach the patients. Absolutely. I think the pandemic has been a really unique opportunity for all of us. And I say opportunity because when we think about where the healthcare world has been over the years, we have learned so much just this past year, probably about ourselves, but also about the communities that we're serving. So I'm just going to share my screen here for a second. Not for a second, but for the evening, and let you know a little bit more about where I'm coming from as I share this information with you. Just a quick note here. When we talked about where do I come from, I work for SeniorLink Caregiver Homes. We're a tech-enabled company that really does a great job balancing keeping care at home, supporting caregivers with the human touch, but also using technology to improve the health outcomes and lower medical costs. And one of the things that our team has absolutely learned this year is that, you know what, caregivers need more support. We have always done a really good job supporting people, but in times of crisis, just like all of these comments that you've mentioned here, they found that people reached out to us even more, about 46% more during the first 6 months of the crisis, because people were scared, they were nervous, and they may not have known they were scared and nervous, but they just needed to be able to connect with somebody who might be able to relate to them. And so at SeniorLink, let's see if I can move my slides here. Oh, sorry. What we've been able to do is use our home-based model as a way to be able to serve Medicaid consumers who have a live-in caregiver. We provide a nurse and a case manager who visit with the family regularly. In particular, pre-COVID times, they would have a monthly home visit in which they were doing things like med reconciliation, doing fall screens, coordinating community services for folks. And then during the pandemic, we were able to quickly move to a remote basis because we have a HIPAA secure app that the team uses on a daily basis to touch base with the caregivers. This allows us to really keep a good pulse on what's going on in the home. We're able to identify any behavior changes or some of those other typical concerns that might make a caregiver say, oh, we have to go to the ER, or oh, we need to, call the doctor, there's this major issue going on. So by being able to connect with them on a daily basis, we're able to really predict and prevent some of the other problems that might have escalated. So in addition to that support, we're able to pay through the Mass Health funding, we're able to pay the caregiver a tax-free stipend for their support. And what this does is not only validate the importance of their role, but during the time of COVID, these dollars have really come in handy because we've seen a number of people who have been losing their jobs or maybe feeling other financial hardships. have found that this is another good way to be able to get some support. So I see some more chats here. Oh, none here. Is anyone having audio issues?
I think it's just one person, Donna. You're muted now.
Okay, so we're back now, right? Okay, all right, good. So what we were just talking about, I was just giving you a quick tidbit of how Caregiver Homes has really been able to take that high touch communication, high touch care management model and be able to adapt it using telehealth and using our HIPAA secure app. And the beauty of this program, it is a mass health service provided in a number of states. It is really making a difference, not only in the lives of the families that we're helping, but it's helping to really decrease costs. And as you can see here, it's saving the state Medicaid system about 50% versus the cost of a nursing home. So we've been really lucky to use our HIPAA secure app to be able to really support families during this time. So our goals today during our program are really to talk about telehealth and what has it meant for all of us so that we can then be able to be ready to move forward. We're going to talk about how this telehealth phenomenon has worked during the pandemic. We'll talk about what kind of screens may need to be put in place to be able to help us be even more effective using telehealth, but also realize that there are some health equity issues that come with telehealth. You know, not everybody is like us right now. We're home after a busy day, or maybe you're still at work. You're able to access some technology, whether I'm muted or not, right? You're still able to get some technology going, but that's not the case for everybody. So we're going to talk about that and talk about the kind of health literacy that families and people are going to need in order to be able to benefit from telehealth. So let's just go to the next slide then. Sorry, for some reason this isn't projecting for me. Okay. There are a couple of key things that we've learned during the pandemic, and I don't think some of this is brand new to you, but we know that adults definitely deferred care during the initial phases of the pandemic. People were scared. They didn't know what to expect if they left their home. They didn't want to get further infected. And they actually found that about 48% of people deferred care. And of those 48% who postponed some of their care, 36% of them said, my condition or my situation didn't get worse. So unfortunately, that doesn't really encourage them to continue getting this type of care that could help keep them well. However, it's duly noted because those are the folks that could benefit for sure from telemedicine. And we also know that the outpatient visits to the hospitals, to the ERs, to other practices were impacted, as you can see in weeks, right about that sweet spot here of the first 52 days in the pandemic, or first 52 days of 52 weeks rather, in 2020, you can see that there was a significant decline in outpatient visits. So this is a typical trend here. Here you can see people weren't going anywhere during those months of March, April, May. We started to feel more confident, and then slowly but surely, we started going back out to the clinics towards the end of the year, but still not at the level that we would have in the previous year. So what are some of the reasons for this? I think some of the main highlights that we can glean from COVID-19, I think it would be that, number one, there were significant challenges for people who rely on community services, right? People who have behavioral health conditions that maybe weren't receiving treatment, who were now locked in and held to a different lifestyle than they were used to. people who relied on food banks and pantries, and maybe even the ability to have their mother who lives with them visit an adult day program, they suffered because those services were not available anymore. There was also the deferred care that we mentioned in the last slide. But then I think there was another big piece here that we need to stop and realize, you know what? People were definitely directly impacted by COVID-19, because there were loved ones who were passing away that they didn't get to be with, whether they were passing away because of COVID, or maybe there was another illness that was diagnosed during COVID and they just couldn't be with the person. There was also a lot of financial strain going on. People were losing jobs, or maybe their shifts were cut back, so they were losing some of the income they typically would rely on. So this kind of financial strain has made people really start thinking a little bit differently about how they want to move forward in 2021 and beyond. And those are the kinds of things that we want to keep in mind. When it comes to, I don't know why this button's not working. Hold on. When it comes to looking at COVID and the impact of race and ethnicity, I think you all know also that clearly there were populations that had underlying conditions that affected their overall health. We know the economic status, access to care, exposure to the virus, living conditions, all certainly did not favor the Hispanic and the Black American communities. And we really need to stop and think about it too, and say, when we look at the social determinants of health and the risk factors for exposure to COVID-19, there were people that couldn't get away from their disadvantages, right? Some people living in multi-generational homes, for example, right? People whose jobs and occupations required them to be on the front line, whether in the medical field or at a supermarket or a post office, whatever it was. There were a lot of different risks that really exposed people. And as a result, they had to stop and either look at their jobs and their lives differently, or stop and make significant changes to keep them and their families safe. So a lot of these go into what's known as social determinants of health. And as you all know, many years ago, this started being a significant focus. And as the World Health Organization calls it, these social determinants of health are really those underlying social and economic conditions that people live in, not so much the immediate needs that one person has. These are the economic factors that can affect somebody's ability to get good health care. These are the things that could impact their ability to get good nutrition, access to care, access to other educational tools for wellness. And so those are what those social determinants of health are. And as you can imagine, with all the other changes that impacted us during COVID-19, those were also significantly impacted. And they've really made us start thinking a little bit more about the HRSN, a new acronym, if you hadn't heard of that one before, which is the health-related social needs. And those are the very specific non-medical immediate contributors to health effects, okay? They're the things that are the gaps between clinical care and community services. They take into account things like the ages and the backgrounds, conditions and experiences of people. And the way that we're able to address these immediate needs is by stopping and getting to know the person where they're at, understanding through screening what their situation is, what their goals are, what their pathways are to resources too. Because for us to be assessing people and telling them, okay, you need this, this, and this, without knowing that maybe they don't even have access to transportation to get those services, doesn't do the person any good. And in fact, it can actually make them feel more disappointed and more frustrated and less hopeful. So focusing in on these health-related social needs is the real important piece of the puzzle as we're going forward in the telehealth world. And so when you look at, when we look at, social determinants of health and health-related social needs, I want you to think about it as being really a map, right? Or the stream or the downhill stream, because it really is that downhill impact. the social determinants of health are up at the top with the community impact, right? That's where there are policies and regulations. There's some government lobbying going on. These are things that will impact the overall community, where broad brush strategies are being put in place to help improve the equity of healthcare and other tools that are needed. It's the midstream area or downstream that we can all have an impact with patients. This is where we're doing screening factors on things like housing and food, and being able to use data to understand how we can best serve the population. This is where community health workers, social workers, nurses, all these other community-based organizations are really focused now to be able to help us provide better care going forward. And we can imagine too, as we're going through this, that there has been a definite need, now that we know, based on that definition, what the health-related social needs are. You can imagine that COVID definitely had an impact on that. In fact, when surveyed, about 31% of people in the KFF health tracking poll said that they had trouble paying for household expenses. 31%, that's pretty significant, right? And of that, it was because so many people had lost income. And so imagine if you and your family were going to bed every night and you had that pressure of credit card debt. You had that pressure of trying to keep the lights on, trying to keep the utilities going. How are you going to pay for food? Those are the top things, top of mind for you, let alone being able to make sure that you have prescriptions for whatever your latest condition is, or making sure that you have the right nutritious food for your diabetes, but your other family needs might come first. So one of the things that COVID also taught us, and really I felt flashed a light for us, is to see that there was significant disparity in adults who were really relying on charity or needing to rely on those government supports. As you can see in particular, that the Black and Hispanic populations, as I mentioned before, absolutely needed to focus, needed to rely on those services because of the coronavirus, much more than the white population did. And we know that they were more susceptible to COVID-19 than the white population was, the more dramatic impact. And so we know that there are definitely social determinants that we need to think about as we're going forward and trying to be able to help our areas rebound from the pandemic and be able to really improve their health. So telehealth to the rescue, right? Telehealth is nothing new to all of us. In fact, anyone want to chat in, what does telehealth mean to you? What's telehealth? Does it necessarily mean it's some fancy piece of equipment that's put in the home? Is it something else? Better access? Mm-hmm. Yeah. We can talk to the doctor without a question. Yes, absolutely. Access to care? Mm-hmm. People need broadband. Yep. Yeah. So breaking down barriers, giving us opportunity to reach people. Yep. No hands-on. Yeah, I'll tell you, we have an awesome team of people that I work with, and this has been a big adjustment. People miss seeing each other, right? Live. They miss being able to give hugs or, just embrace people. And that goes along with there is no hands-on care with telehealth. So it is very different. But it requires us to think differently as practitioners. It also requires consumers to think differently. And I see, Karen, you do majority of your work telephonically. How long have you been doing it that way? All along? She's a veteran at it, I bet. So I think back to Karen's point here that she does most of her work telephonically. Telehealth is not brand new, right? If you think about back years ago when people were offering a 24/7 nurse call-in number, right? That was like a wow, my insurance comes with a call, you know, a 24/7 helpline. And then it became you could call your primary care physician or your child's primary care physician and be triaged and speak to an urgent care nurse who would help you troubleshoot the situation. So now what we're doing is just taking this advancement in telehealth, because that sort of set the foundation for us, and now looking at it and saying, how can this be taken to a new level? Telephonically for 10 years. Okay. Yep. So telephonically certainly is different than video chatting, right? So we're seeing that interactions include patient to patient or patient to provider, but it's also allowing physicians to connect with each other. People are using their phones, they're using tablets, they're using laptops. But yes, some people like to, they just prefer to do it over the phone as well. But the demands on telehealth continue to rise because as consumers, our expectations are high. We want to be able to get people right away. We want to make sure it's secure. We want to make sure it's clear, and we can, you know, avoid having to go into any setting that would put us at risk. So telehealth is definitely continuing to grow, and payer support for this around the country definitely varies. There's always going to be, you know, some policy being worked on. And I know in particular in reading that Medicare did make some adjustments for telephonic reimbursement during the pandemic, but there is certainly more policy information being worked on, because we know that in order for telehealth to continue to grow and support families, it needs to be able to expand. It needs to be able to be confirmed that it's secure. People need to be able to access it. It needs to be able to communicate with the other tools that you're working with. And this all requires money and funding and new products to come out to the market to make that happen. So how is telehealth improved? Well, if we were to put that initial graph that I put out there about medical care and utilization, we would see the same thing. We saw medical utilization going down, but telehealth was going up. And so clearly people are embracing it. And in fact, one benefit I'd share with you, I participated in a conference call, or maybe it was a Zoom, for the special need, the children of special, let me double check. Sorry, it was the Federation for Children of with Special Needs. And it was a group of people meeting out in Western Mass. And I heard a couple families speak about, wow, we bring our child into Children's Hospital several times a year to see all their specialists. We love the opportunity to be able to do telehealth for some of those check-in visits. Because think about it, for them, this one family in particular said their child is drained by the time they get and fight the traffic on the Mass Pike. They get into Children's Hospital, and then there are a number of visits, right? You want to make the most of your time, and then you have to drive all the way back out. And so they said that it was so taxing on the child and on the family. And then when you roll those dice of New England weather and you throw in some weather, the family said they actually ended up probably in a hotel room 1 to 2 nights a year, because they got snowed in, or there was risk of ice and they didn't want to miss their appointments. So there are a lot of real benefits to telehealth, and for complex care in particular. And there's another big benefit. Has anyone here experienced or focused particularly in your practice on behavioral health? Do we have any BH specialists here? Just looking at the chat. Behavioral health has had the highest percentage of televisit medicine, telemedicine visits versus their baseline than any other type of program. Anybody would tell me, why would behavioral health have such a high percentage? Booming demand for sure. Yeah. Why else? Let's talk. Yeah. Yes, that's right, Holly. It's not hands-on. It doesn't require it. Communication, it's confidential. Yeah. Yeah. All of those pieces. And sometimes unfortunately, I feel like nowadays with newer generations coming through, there is not a stigma about getting behavioral health services, right? In fact, I think a lot of people are growing up now and thinking of it as part of the primary care umbrella. However, I think back in years and years ago, people may have shied away from that and felt, oh, there's something wrong if you needed to be able to talk to somebody about your problems. So people are definitely, voting with their feet and saying, hey, it's easier access, like Cheryl said. I feel more comfortable. I can just talk wherever I am. People are taking these calls in their cars. They're just feeling the need to express themselves. And during a time like a pandemic, this is needed more than ever before. And I recently I listened to a panel of the leaders for the Boston hospitals during a Boston Business Journal conference. And they were talking about what is the future going to look like? And is this, what can we really expect? And they all talked about how the fact that during the pandemic, they really, worked closely together and they really relied on each other. And they were doing things like sharing ventilators and talking about volume and how they can, really conquer this pandemic. And the president of Children said, he said, this may not be considered a child's pandemic, but we are experiencing a behavioral health pandemic. And especially in the years ahead and the months ahead, when we think about how things have impacted kids from developing in the way that they used to, right? The way that we knew that they used to. And so I think this behavioral health piece is definitely going to continue to grow. So let's talk then about what are some of those limitations that might come about with telehealth. Well, we talked about it. Privacy is certainly important, but not every system out there is private and confidential. So we need to make sure that privacy is job one, right? I read that Medicare would support telehealth visits that were done on Skype, Zoom, FaceTime, but it said they would not accept or reimburse for telehealth visits done by, what was it, FaceTime Live or TikTok. So, well, there goes the TikTok idea. But, people have to really think about what are the ways, and organizations to think about what are the ways that we can really reach people in the way that they can be reached or in the way that they're comfortable. Not everybody has technical literacy. I think about, unfortunately, we had my father passed away in September. He was 84 years old and he used his iPhone. My word, that was such an amazing opportunity for us to stay in touch with him. Not every person in their 80s is tech savvy. He was an engineer by trade, so he was able to send us emails and send us updates of what was going on. But imagine if you are somebody who has come to this country where English is a second language. You maybe are still trying to figure out who's on first in this crazy healthcare system that we have. And on top of that, you don't have Wi-Fi and you're not really comfortable using a computer. Well, those folks definitely have some challenges in trying to access telehealth. So we need, as practitioners, to be thinking about what are the ways, what are the barriers, so that we can try and overcome some of those for people. There is also a significant need for some more universal screening and some needs-based screening, and we'll touch on some of those things too, as well as to think about what kind of training do we need to be able to be effective practitioners. And I'm saying practitioners to you. I'm not a practitioner. I'm a wannabe practitioner. But we need to think about what are the skill sets that are needed. Is there training that's needed to be able to facilitate these kinds of programs? Years ago, I was teaching a public speaking program, and I had a physician talking to me, and we were just talking about business and people skills and things like that. And he said, the thing of it is, he said, it's not that I'm against doing the speaking. I never really developed those social skills or that ability to sort of interact and engage like that. Because as physicians, we were always, he was speaking for himself, not all physicians, but he said as a kid, he goes, I was sort of like the quirky kid. I was the smart kid. And then, I studied really hard to make sure I got into the best college. And then during college, I wasn't out at the parties developing those social skills. I was focused on my studies and I had different interests. And then I got into medical school. And again, it was working crazy hours and it was nonstop studying. He said, so these people skills, this communication stuff isn't something that was part of our curriculum back then. And so I know that the world has changed significantly now and people are developing more of those skills, but I do think it's one of those things, if you don't use it, you lose it. So we're going to have to really start looking back again and saying, what are the skills that are needed to be able to be effective with telehealth? And keeping in mind also cultural sensitivity for that. And then also we talked about before the interoperability and making sure that our systems will communicate with each other. If it's not easy to use, people won't adopt it. And I think one of the things when we think about what are the barriers that the families you're working with might be going through, this is just a list. I just wanted to sort of help put in their mindset in case you're sharing your thoughts of what you talk about or what you're discussing here tonight with any of your colleagues. We as people and patients and whatever other title you want to give us, we've all gone through a ton in this past year. People have lost not only the freedom to socialize, right? That's the poor me situation, but people have lost routine. They've lost relationships. They've had sudden onset of death, unemployment. These are things that have really caused a lot of people to really regress and really get off track. And so reminding ourselves that there really have been a lot of these mental and physical challenges is important as we're trying to embrace people and talk to them about some of their needs and their health as a whole. So what are some of the tips and things that have come out as organizations today are stopping and looking to say, well, okay, what can we do about it, right? Well, number one is, as I showed on the last screen, remind yourself what people have been through. You may say, oh, I know it. But in the hustle and bustle of the day, it's sometimes easy to forget, right? So we sort of have to stop and remind ourselves. The City Block Health found that they said that we need to be able to make sure that patients know, or let me just double check on this one, make sure that a family doctor or pediatrician is aware that certain questions can be off-putting for patients. Right? They may not know what we're trying to get at. So we may need to explain what questions we're asking and why it's important. We want to make sure that we're looking at the whole person so that we're addressing the whole situation. So for example, if I'm working with a family member who is worried about taking care of their ailing dementia parent and trying to be able to entertain them while still working at home and taking care of a special needs child, I need to know all of those components of their world to be able to then stop and say, okay, maybe we can then address why they're not doing anything for their own self-care. Maybe we can find them support from the Alzheimer's Association. Maybe there are some other tips or connections we can make for their other child. So knowing that whole person and their environment is really, really important. And as Dr. Monica Peak said, we have to engage people in ways that they feel safe and trusted. I had the opportunity to participate and view some practice telehealth visits with some specialists of children's, and it was really interesting. They were so great, and they were very careful to make sure that they didn't jump right into business. There was some rapport building. There was opportunity to stop and really engage and ask how things were going. How's everyone doing? Then we got down to business and then we summarized it at the end. So I think it's really important that, even though there's a very compressed period of time that we can spend coaching people and helping them, that we're very mindful in making sure that that rapport is built to be able to build trust and help people feel safe enough to be able to open up and really share their concerns with us. So what do we do next? Well, obviously there's a lot. We talked about telehealth. We talked about the need for social determinants of health. We talked about the things to be able to really hone in on an individual's needs as well. Whoop. One of the biggest things is we need to be able to screen for necessities with families. We need to be able to, again, as we said before, be sure that we're trained in interviewing, empathic inquiries, active listening, make sure that we're able to develop trust and develop really deep relationships with people, making sure also that we have a team of people that we're working with so that there's a follow-up mechanism. I don't have to tell any of you that when somebody doesn't follow up with us on something that's really important to us, it doesn't feel good, right? So imagine if you're working with a family who's really struggling or working with a patient who's really, really struggling and their needs aren't being met, and you say, okay, I'm going to connect you with this service. I'm going to have this person call you. And then that person doesn't hear anything about it. It can be real upsetting and they can really start to lose hope. So I would really recommend not only that you build in a follow-up mechanism for yourself, but also ask your referral partners for a follow-up mechanism. I've talked many times with referral partners where we'll say, oh, we wanted to give you an update of what's going on here. The person didn't qualify for the service because of A, B, and C, but we did recommend that they try out D. Well, that helps you have a full picture of what's going on there. Or, hey, it did work out for them and here's how they're benefiting so far. So definitely it would help you if you held your referral partners accountable on that kind of thing. And use an asset-based approach, focusing in on the strengths, not so much what we don't have. So this really, I go back to hope and helping people develop a little bit more hope, because when they can feel a little bit of that light at the end of the tunnel and they feel that their extra effort's going to be worthwhile, they'll put that effort in and they'll communicate and feel a little bit more accomplished. It's going to help them better understand what they need to do to improve their situation. It's going to help you also be able to connect people to more resources. So if we ask somebody more of the other type of approach, a deficit-based approach, and we ask them the questions, for example, do you have a car? Do you drive? Right? The answers to those things right off the bat are no, no, right? Automatically, no's are making them say, oh, no, I don't have that. I don't have that. As opposed to a strengths-driven question could be something like, how do you get around to your appointments? Right? They could say, oh, I usually am able to get a ride from my cousin or my niece or my nephew, or I take a bike, or I find public transportation, right? That gives them an opportunity to come from a strength as opposed to talking about what they don't have, right? An asset-based approach is also going to have questions that are more internally focused and really thinking about where is that person at and how can you bring it up another level. So for example, if a patient is newly diagnosed with diabetes, right? And we know that they're used to cooking the way they did back in their old country. And they know that there were a lot of oils included and a lot of high fat foods, or maybe they were consuming a lot of processed foods. Knowing through communication and talking to them, find out that they really love to cook. Say, geez, you know what? Let's share and talk about some ways that you can really change some of the cooking or improve the cooking that you're doing, as opposed to being a little bit more negative, which might elicit a different response of, you're going to have to start cooking totally differently, or you're going to have to start eating differently. You can't eat out anymore, right? So framing questions up differently is going to be an important thing. And we'll share some of those tools, those screening tools with you as well. Has anybody, just a quick question, anybody find that they're using more of this asset-based style of screening lately or over the past few years? I find sometimes working with social workers, this comes to them very naturally, and that's just what they're doing, more in that consultative approach. And it's easier to do maybe sometimes in person than over the phone, but the more we practice these kinds of questions and focus on that, the better that outcome can be. Okay. So some of the screening models, so the first piece we just talked about was thinking about asset-based screening, then developing models. Oh, sorry, Mary, let me see here. Would be nice to have. Oh, and wouldn't you know, Mary, that's the one that I added in myself. I will be sure to share that with you. Is it, I'm happy, let me just make note of that. Versus deficit-based. I'll be happy to give you that one. So I'm sorry, I did forget to mention early on, I want to give a big thank you to my former colleague and very good friend, Emily Nevada, who we worked together for a number of years, and she has since moved on to another position at another company. And she developed the basis of this presentation, but in looking through it, I decided there were some additional pieces that I wanted to add, in that asset-based and deficit-based chart were one of the ones I added. So I'll be sure to make that available for you, because I know it's not in your slide deck. So happy to do that. Thank you. So going along with that, we want to be able to develop those screening models, thinking about who are our staff, what kind of capacity do they have, who are the partners that we're working with that might also have some capacity to be able to help with some of these screens that we're doing. You know, already people are using typical diagnostic examples to be able to get at who are the highest utilizers or who are the people that are most at risk that we need to help. But really thinking about these types of screening models, it's what's going to help you then move it into action and think about how to make it happen. So I know we're all using tech here. I'll give you an example of what a screening methodology might look like. If you've ever shopped online, and I'll say I've done a bit of shopping myself in the years, especially this past year. You sometimes would have shopped and gone to a couple stores if you were looking for a particular type of shoe, say, for example, right? I might go to a couple different stores. I might look at a couple magazines, see what's going on out there. Not that I'm a slave to fashion, but I might want to do a little bit of info gathering before I actually go online and place my order. And then once my order's placed, I'll get a confirmation. I'll then get an update of when that's going to be mailed to me and let me know when my package will arrive. Every one of those touch points could be what's considered like a customer mapping or a journey map. And I think that the similar type of thing needs to be thought of when we're looking at screening and further identifying opportunities to support patients. So we need to step back and say, for each of the type of patients you're looking at and working with, whether it's over the phone or face-to-face, what are some of those touch points, right? Is there pre-visit outreach or telephonic work that can be done to help prepare them or to help the practitioners know what to expect when they do meet with them? Is there something online that they can fill out? Is there if they're going in person to the doctor's office, are they being handed a tablet to then fill out radio buttons that have some basic questions about, are you ever in fear of your life? Have you had any problems gaining food for your family or proper nutrition? Do you feel secure in your job? Anything to be able to help people who are helping them from the clinical side better understand what their situation is. So those kinds of things need to be considered. And there's old school ways to do it. Certainly you can give people a clipboard and have them fill out a survey. You could mail it to them ahead of time with a self-addressed envelope. right? And have them mail it back, or you can use some of the other technology that's available to do it. But the more information we have up front, the better we'll be able to help people, because we don't know how somebody's going to present to us on the day that we actually connect with them. So I think about my mom, who had a very intense immune disorder right before she passed a few years ago. As sick as she would be at home, before we would go into Mass General for her appointments, the lipstick's on, the jewelry's on, she's dressed. The doctor would look at her and goes, "Wow, you look good. You you feel good? You feel pretty good?" She'd go, "Yeah, I'm pretty good." And I'm saying, is this the same person that we just talked to, or just picked up and brought all the way in town? So my point is, people don't always present the same way each time we meet with them. So when we're thinking about what are some of those opportunities to screen somebody, think about all those other touch points and what you might be able to do to capture more information. Then also think about what are the reliable resources that are out there that you can refer people to. Again, keeping in mind their technical ability, their ability to connect. Okay. Mary, I lived in your world, right? Our mothers were friends, probably. I will tell you, I've been with caregiver homes now for about 5.5 years. Before that, as you heard, I was in some other health related industries. And the thing I love about being in this mass health focused business is it has opened my eyes in an amazing way as to the amount of services that are available for people, not just mass health recipients, but just people in general. You have a struggle, go online, check out some of these resources. Aunt Bertha is an organization that has an online tool that's available for community resources. You can type in home health agency, you can type in food resources, whatever it is. 211 is one of the new things that cities have incorporated over the past year. I know Revere in particular had a 211 number where people could get city specific support. I'll touch on some of the other organizations that are out there, but I would encourage you, if you don't have sort of your go-to reliable resources, develop some real trusted partners that you can count on that will not only support your patients, but then give you that feedback, okay? Because having that constant communication is really important so that you know what's working for the person and what's not. Be familiar with what's going on in their lives for further follow-up. One of the organizations, I'll just move to this next one, is CHNA, which is the Community Health Needs Assessment. Oops, sorry. You can always go to their website as well to be able to find information. You can see here, there's all kinds of information about obesity, diabetes, behavioral health, all kinds of tools here. I think this is also in your handout, as well as the next one, which is a community action partnership. I went online today just to be able to share a little bit more with you about this. And I just typed in a town, I typed in Westwood, Quincy Community Action Program popped up, right? These community action programs are all around, and you can see this seems to me like like a little bit of one-stop shopping here, right? For the patient who has a loved one in their home who may be having challenges, they just lost their job, or maybe the family themselves are concerned about keeping the heat on this winter, or they're looking for some utility discounts. There are a ton of services out there for people, and we owe it to them to help them find them. And that's one of the things that really keeps me motivated, because our space is working with caregivers, but I can tell you, having been a caregiver, being a caregiver, or being a patient, you're just focused on getting through that day and trying to keep the person safe and healthy, make sure they're clean and their medications are taken care of. But you know what? They don't have time and energy to stop and think about these other resources that they could benefit from. So if you can arm yourself with some of that, it's going to really make a big difference for your patients. And the other piece I wanted to just share, and this sort of is hijacked from another organization or another person that I've heard speak before, where they say, you know, right now where we are isn't what matters. It's what direction we're moving in most that matters. And so when we're thinking about, you know, building those skills again, thinking about what does telehealth mean for us in the future, it means all of us helping to improve our skills, right? Being more culturally competent, being better listeners, being asset-based. Those are just some of the tools that you can go to be able to really develop those skills a little bit further. I think these are all in your handouts, so you have some good resources there. Obviously, the AHA has some really good resources available too. NCQA. And then for screening tools, going back to the asset-based stuff, I did take an opportunity to look up the CMS page and their screening tool. And this is just one of those examples that shows about asset-based questioning. Look at this one. In the past 12 months, has lack of reliable transportation kept you from medical appointments, meetings, work, or from getting things needed for daily living? Yes. In the past 12 months, has the electric, gas, oil, or water company threatened to shut off services in your home? Yes, or already shut off, right? Psychologically, being able to answer yes makes a big difference for people, okay? Versus if I asked in place of question number 6, I said, have you paid your electric bill this month? No. Do you have enough money to keep your lights on? No. So instead, this is just another way to be able to ask those questions. This question here on safety, because violence and abuse happens to a lot of people and affects their health, we're asking these questions. How often does anyone, including family and friends, physically hurt you, right? This is just an opportunity for people to have that opportunity to share with you what's going on in their world, so you can then use some of those other tools to help them get resources. So these again are in your handouts, just giving you some more examples of those screening tools that will be so important as we're trying to support people in their social health needs. Okay. And I'll just flip through those a little bit more. And then going back to at Caregiver Homes, how we're able to use tools. We have, as I mentioned before, that HIPAA secure app. What we're doing is using that as a way, not only for COVID risk screening, which we've been doing all along, but we also use that as a daily check-in with our caregiver. Have there been any changes in behavior? How are things going today? How did mom sleep last night? There are a variety of different check-ins that we have. And then based on that, we're able to push out content to that family, to that caregiver that can help them with things like, in this case, this example shows tips on hand washing, how to keep your loved ones safe during COVID-19. We're also doing significant education about the importance of the vaccine, right? Being able to give people the tools they need where they are and where they're at is most important. And I know that telehealth has allowed us at Caregiver Homes to really be able to do that and help people during these times of crisis and beyond. So I'm welcome to be able to share with you any other information you would like about other screening tools or anything about Caregiver Homes. But I just wanted to be able to let you know that I think that really telehealth is just growing. We need to be able to make sure that we're prepared and able to help families make the most of these resources. If people are having trouble accessing telehealth, we need to find ways to help them have the adequate access. If they're having trouble with interpretation, we need to help them with that. And so it's really up to all of us to help make telehealth work and take advantage of all that it has to offer. So with that, that is the end of my formal part of the presentation. You can see there's a variety of other resources available there. I'd like to know if you have any other questions or comments that I might be able to help with. Or Karen, were there any questions for us?
There actually were not any. I think given that you had a chat box, some of them came up at that point, but I don't have any new questions.
Okay, great. And what I can do is share, should I send to Karen? How should I get this final deck out? I know there were a couple of new, oh, here's a question. How do we help seniors with memory issues? Let me just move this chat up from Mary. With mild memory issues and new technology. Thank you. Oh, there are a lot of different pieces that come with that. You know, the councils on aging and senior centers, unfortunately, I think they're starting to open up a little bit and do some offerings. There are a lot of opportunities to be able to introduce people to some of this kind of technology. But as far as people with memory issues, I think giving them bite-sized pieces of information to learn and then having cue cards is one of the ways that can certainly help. Having a caregiver alongside them who's able to sort of walk them through these things on a regular basis is important. The other place I'd check is look, you know, I can't speak highly enough about the Alzheimer's Association and all the resources that they have to offer. There are a lot. Okay, often the senior presents herself as just fine and doesn't screen in for additional services. Yeah, it is difficult, right? They do. People absolutely, we sort of have become accustomed at times to never let them see you sweat, right? Does anyone have any other tips on what do you do when somebody screens through as just fine, but you have a feeling that maybe there might be some other issues going on there that you could help with? So if independence is the last wish. You know, anybody, any other tips on that? And I'll give you an example. I'm going to type in 3 words for you here. Feel, oops, felt, found. So this is a tool that you probably have heard something like this before. It's a way to be able to sort of respond to people, any concerns or objections that they might be having. And so if you think that somebody would be screening in differently than they are, you might be able to use something like feel, felt, found. Just ask without judgment and just say something, you know, I understand how you're feeling right now. You know, other people in your situation have felt the same way. And what they found is when we were able to provide them with XYZ, name it, right? We were able to help them with a home health aide who was able to help them with some of their, you know, daily meals. They felt really good about that and they were able to keep their weight on, right? So feel, felt, found could be a tool that you could use. So another example of that is, I understand how you feel. The technology could be really overwhelming at times, and you may feel like you have all the resources you need. You know, other people have felt the same way, and what they found is by going to the library, they were able to do a very simple search to this easy website where they could print off articles that would actually have some healthy meals that they could prepare at home for one. So feel, felt, found might be a tool. And then Peggy chimed in and said, just ask without judgment. Yeah. It's not about judging for sure. It's about just trying to help people. All right. Any other comments or questions? Great. I will send to Maureen the latest deck, which just has a couple of added slides in here and a couple of tweaks so that you all have the latest and greatest. And then that way you'll also have that connection to the asset and deficit based questions. Okay. Thank you all so much for your time, unless there's anything else we need to cover.
I don't see any more questions. Thanks a lot from Mary in the chat box. But I do want to thank you again, Donna, for doing this presentation and for stepping in for Emily.
Yes.
And also for Caregiver Homes for their sponsorship of this event. So
Thank you.
thank you so very much.